Okay, I'm Elizabeth Dantes. I'm the CFO of Cardinal Santos Medical Center. This is part of the group of the Metro Pacific group of companies. So in the group, we're 13 hospitals. And I've been in the hospital for the past 8 years as CFO.
And what are the current challenges that your hospital is facing?
Well, of the past several years, we've been looking at a very stiff competition, not just from the primary hospitals or the tertiary hospitals around, but I think there are more doctors who have been putting up hospitals, and these hospitals are just well within the vicinity of Cardinal Santos, and there's competition. Aside from that, there are certain laboratories that are being set up around, which are cheaper simply because the overheads are cheaper compared to Cardinal Santos. And these are eating up into our revenues over the years. And another challenge is actually the rising cost of hospital care because the cost of medicines, drugs, pharma, supplies have been going up. And to some extent, we don't have any control of this.
And so, obviously, you said there that you perhaps don't have much control of the cost of drugs, as that's determined by other organisations. But with the primary problem that you discussed, the sort of the competition of hospitals in the Philippines, how do you think it might be possible to overcome that problem?
Okay, I think the strength of Cardinal Santos is really on the expertise of the doctors. And at the same time, I think we really have to make sure that the patient experience is superior above all. So our patients don't mind paying a premium for as long as they expect the best care. So I think we're really more or less within the area of really facing the challenge upfront and at the same time making sure that our services are consistently superior, excellent.
And so, are there any particular projects
I'm sorry.
that people are focusing on in your hospital to try and tackle that?
Okay, just recently we opened the PET CT scan. Okay, this is the third PET CT for our hospital, and I think we're able to gain the mileage. This is a gold standard in terms of onco procedure diagnostic, and I think we have put up the level of Cardinal Santos in at least a one notch higher. So, in terms of equipment, capex, we have been trying to improve year in year, for more modern, high technology equipments, and I think we're well within the competition because most of the patients would always want to get into a hospital with very good infrastructure, good machines, new machines, top of the line. Most of our patients are well informed and they have choices to make. So I think doing this would make Cardinal Santos a top of mind hospital in area.
And do you think this is a problem that is facing other countries in Asia?
Well, I think this problem is not isolated in the Philippines. These are the problems that we see when we talk with doctors, hospital administrators, and they say that the competition gets stiffer because of technology changes as well. So now you can have doctors from the clinics with patients from the home. There's telemedicine. So I think the technology is also disrupting the medical space.
And so, does your centre have any focus in terms of technology innovation that it plans on implementing?
Well, I think we don't have a choice. We have to keep up. Otherwise, we'll just outmarket ourselves. And the best way is really join where the majority or the people are going through. So people would like maybe to do some consults at home if they don't need to go to the hospitals, especially in Manila where traffic is worse. So you'd rather go home and be home and speak to your doctors. And I think the only challenge would be making sure that we have a very good communication line.
And so, do you think that the technology that you need in order to do this is available, or do you think there's a gap in the market that some of the technology providers could look to fill?
Okay, it's just fortunate that Cardinal Santos is part of the bigger group of Metro Pacific, and two of our companies here are Smart and PLDT, which are both in communication. So I think this would be a good help for us setting up the system immediately, and at least we have people who would support us.
And so so what were your specific objectives in coming to HMA? Obviously you're speaking, so you're sharing a number of insights, but is there anything that you came to take away from the show?
Okay. This is my third year, second year to be a speaker. And over time, there's a new experience. You meet people, you meet a lot of ideas. There's a lot of innovation taking place. And I think this is where medicine is going, innovation and technology. So I think I'm in a good space. There are new ideas that you learn from. And looking at all the people here, everybody are just enthusiastic to learn from everybody.
And so what, if you could perhaps just give us a snapshot of what your presentation here at HMA 2017 is focusing on?
Well, actually, it's about the dashboard. So what is the financial dashboard that's more appropriate to any hospital? So I discussed what the dashboard should look like coming from the point of view of a CFO or a point of view of an operations person. And I was just happy people were just enthusiastic listening to the dashboards that we have presented.
And if you were to join us again, and hopefully you will, at HMA 2018, what is it that you'd hope to be presenting, for instance, then? I mean, what is it that you'd like to have achieved in the next 12 months at your centre?
I think I'd like to present the journey of Cardinal Santos. We're a hospital that was acquired 8 or 10 years ago from another operator. And I'd like to present here how Cardinal made it and were the challenges, the steps, the journey that we made, and how we overcome all of these challenges.
And so, talking more broadly about the healthcare industry in Asia, are there any predictions that you have for the next 12 months?
Well, I think technology is creeping in, disrupting our industry. The disruption would always be good for the good of our patients.
And so, final question. Obviously, as part of HMA 2017, we try and bring lots of different countries and lots of different hospitals together. And even we're doing some tours of different hospitals around the Philippines. If you could visit any hospital, either in Asia or across the world, is there one that you would pick? Someone that you could go and learn something from and see maybe their financial operations in their hospital?
I'd like to see a third world hospital and a first world hospital. See the comparison and what makes them successful in their own ways. So I hope to visit them.
Thank you very much.
Thank you.